Hi, Mr. Foster. I'm Tori, and I'm with the Respiratory Care Department, and I'm here today to place a nasal airway for you, and then we're going to do some suction, and we're going to just help you suck some of that junk that you've got down in your throat. We're going to help you get some of that out since you're having trouble doing that. And so I'm just going to go ahead and wash my hands and we'll get started. So I just want to go ahead and get an assessment of you. I need to make sure that I have your vitals, your SpO2, your respiratory rate and pattern, and then the first thing I need to do is hyperoxygenate you. And the purpose of the hyperoxygenating of the patient is just to get those oxygen levels up because we are going to be doing some suction. And so what I would like to do is first I need to find the appropriate size of nasal airway for you. And so to do that, I'm just going to measure from the tip of your, or the corner of your nose to the tip of your ear, just like this, to make sure I have the right size. And this is an 8 millimeter. Okay, so I'm going to go ahead and hyperoxygenate you here. I'm going to have you take some nice deep breaths for me. Is that good? There we go. Get some nice deep breaths for me. Okay. Alright, and then we're going to go ahead and place that oral airway, or the nasal airway, excuse me. So I'm going to go ahead and put some of this little Solugel, water soluble lubricant, and I'm going to just go ahead and slide that through the nasal airway through there. And then when I insert the nasal airway, I'm just going to use the beveled side. I'm going to place that toward the septum. And if you feel resistance, you don't want to just push through the resistance. So if you meet resistance, you probably need to try the other nair. Go ahead, and I've got my airway. I have my airway placed. So then it's time to go ahead and open up the sterile suction kit. I'm going to apply the sterile gloves. And then I'm going to put some sterile saline into my little basin, and I'm going to use that to help check for proper suction. So for this adult, we're going to use between -120 and -150 for our suction. I'm going to have a non-sterile hand and a sterile hand. So with my non-sterile hand, I'm going to attach my suction catheter to the suction on this side, and then I am going to use my sterile hand, and I'm going to check that my suction is working by placing it into my sterile solution and including the thumb port. Okay, and then what I'm going to do is the same thing I did with my nasal airway. I'm going to place some of this soluble gel in my hand, and I'm just going to run that catheter through there so we don't meet so much friction. And then I'm just going to go ahead and wrap that around my hand. Okay, and then with my sterile hand, I'm going to go ahead and insert the catheter until I can see breath inside the tubing, or until I can hear a patient cough. And then I'm going to go ahead and begin to retract, and I'm going to include the thumb port and suction on the way out, which should take less than 15 seconds. Then I'm going to go ahead and dispose of my disposable catheter, and then with my non-sterile hand, I'm going to go ahead and re-oxygenate my patient for at least 1 minute after the suction process. Of course, we could also obtain a sputum sample if we needed to during suction, but we didn't need to this time. So I'm just going to re-oxygenate my patient, and I'm going to assess them. I'm going to take their vital signs, get their SpO2. I just want to make sure that they're doing okay, and then I'm going to get them positioned, make sure that they don't need anything from me. Now, since we're going to be doing some more suction, Mr. Jones, I'm just going to leave that nasal airway in there. It just will help us to lessen the trauma to the nasal airway. Okay? If you need anything, just let me know. Okay, thank you.